So now let's talk about the control of blood flow and how we direct that either to different parts of the body or how we may affect blood flow to help us regulate blood pressure. So blood flow can be regulated by a couple of major different mechanisms. One of those we're going to refer to as either through nerves or hormones, and those are typically referred to as extrinsic mechanisms, and then the others we'll refer to as local factors. So with regards to extrinsic control, we are going to be focusing on neural mechanisms. We will be talking about some hormones and other chemical messengers later, but for now, primarily thinking of this as being neural, and this means we're going to be discussing the autonomic nervous system. With the autonomic nervous system, we have the parasympathetic and sympathetic. Now, as it comes to regulating blood flow to specific or to tissue beds in general, or with regards to regulating blood pressure, the parasympathetic system actually has very little impact on this. There are a few areas in the body where parasympathetic does play the primary role in affecting blood flow, but for right now we can say that those effects are negligible, and we're really going to be focusing on the effects of the sympathetic nervous system. So the sympathetic nervous system is the primary division of the nervous system that's going to help us regulate vessel diameter in the context of this extrinsic control. So systemic arterioles, that term is what we're going to use to describe arterioles that go out to various tissue beds. And these systemic arterioles are innervated by the sympathetic nervous system. And again, to highlight this term systemic arteriole, whenever I use the term arteriole, by default I will be referring to systemic arterioles. If I want to describe an arteriole to a particular type of tissue, then I will designate that very clearly. So the sympathetic nervous system is going to be innervating our systemic arterioles, and they are going to have alpha receptors. So this is a type of an adrenergic receptor. When an alpha receptor is stimulated, it causes vasoconstriction of the vessel. So alpha stimulation causes contraction of the vascular smooth muscle, resulting in vasoconstriction. And as we've talked about previously, if we vasoconstrict a vessel, we're reducing its radius, and as a result, we're increasing resistance to blood flow. This is a picture which just demonstrates a sympathetic nerve innervating an arteriole. And realize that our sympathetic system has what we call some tonic activity, which means it's always causing stimulation of the smooth muscle to some degree. So let's imagine that this represents the frequency of stimulation of a typical systemic arteriole. So we can adjust the radius of that arteriole by either turning up the sympathetic stimulation, which will result in vasoconstriction, or by reducing sympathetic stimulation, which will result in vasodilation. Okay. So sympathetics are going to be or have the ability to both vasoconstrict and vasodilate, and that's solely based on the frequency of stimulation. Local factors or intrinsic factors also play an important role in controlling blood flow, and this is going to be related to some of the properties of smooth muscle. So smooth muscle, as we've talked about previously, has the ability to respond to a lot of different local factors, resulting in either constriction or relaxation. So one of the interesting things is with our physiology, with normal physiology, these factors are going to be relied upon heavily to make sure that we are providing adequate amount of blood flow to our tissue beds. So these local metabolic factors are going to change based on the local metabolic activity of the tissue. So if we have an increased metabolic rate in a local tissue bed, we're going to see the following changes in these factors. We'll see an increase in adenosine, CO2, hydrogen ions, and potassium. So this is all going to be a result of the increased metabolic byproducts. And we'll also see a drop in oxygen. So in this particular direction of these factors changing, this is going to have a direct effect on smooth muscle, and it's going to cause it to relax. So within a arteriole, that means these factors are going to cause vasodilation. So this then is the basis of what we call functional or active hyperemia. So hyper means an increase, emia is blood flow. So if we have tissue that's metabolically active, it's going to release these factors, which is going to cause vasodilation, which is going to cause an increased blood flow to that tissue bed. Hence the term functional or active hyperemia. Now at this time we're going to introduce a little variation of what we've just said previously. So I did make clear that our typical systemic arterioles have alpha receptors. These are two exceptions to that. And if I want to discuss that exception, I would specifically identify arterioles going to skeletal muscle or arterioles going to coronary arteries. So these have different receptors on them. These do not have alpha receptors. These have beta 2 receptors. And when the beta 2 receptors are activated, they cause a relaxation of smooth muscle. So they cause dilation of the arterioles. So they're going to make it easier for blood to flow to skeletal muscle and to the heart when the sympathetic system is firing. Now, this doesn't negate the importance of local metabolic factors. So the local metabolic factors are also going to play a role here in making sure that skeletal muscle and heart get their adequate nutrients or their adequate blood flow. So I've seen one text describe this as when we initially begin our fight or flight response before our muscles have actually been active, then the sympathetic system plays an important role there because it can immediately dilate those vessels, getting blood flow to the tissues that are going to need it. Once we're in the throes of that increased activity, then those local metabolic factors are going to become more important, causing direct vasodilation of the arterioles, leading to both of these tissue beds. Now, we've talked about active hyperemia. This is a variation or a different variant, but based on the similar principles. If we temporarily obstruct the blood supply to a particular tissue bed, we'll realize that those tissues still are going to be alive and they're still going to be producing their metabolic byproducts. So they're still going to release all of these things we talked about, as well as have a drop in oxygen, and that's going to cause those arterioles in that tissue bed to dilate. But the blood flow has been obstructed. Now, once we release that obstruction, because the arterioles that the blood is going to be flowing into are dilated, it's going to result in an increase in blood flow. So this is called reactive hyperemia, an increase in blood flow in response to the release of an obstruction that was previously present. Now, let's look at some more local mechanisms, and this is one called autoregulation. So this is the ability of a tissue bed to basically regulate its blood flow. And one way that we can look at this is called myogenic autoregulation. And this is going to go back to some of the properties of smooth muscle, and in particular single unit smooth muscle or vascular smooth muscle. So what we know is that single unit smooth muscle responds to stretch. And the reason it does respond to stretch by contraction is because this stretch is going to activate or open up mechanically gated calcium channels. That leads to increased calcium in the smooth muscle, which leads to contraction of that smooth muscle, and in the arteriole leads to vasoconstriction. So let's show how that plays out graphically. Let's imagine we're looking at three different variables: pressure, flow, and resistance. So if we start off with this being our baseline, we have a baseline mean arterial pressure pushing the blood, driving the blood to the tissues. Those tissue beds have a baseline resistance, and this pressure going against that resistance is going to result in this much blood flow. What happens if we increase the pressure and we keep the resistance the same? We would expect to see the blood flow increase as well. And if we keep our pressure elevated and we do nothing to the resistance, then our blood flow would remain elevated. But this is where the myogenic autoregulation comes into play. This increased pressure causes stretch of the vascular smooth muscle. That in turn causes constriction or causes contraction of the muscle, which results in vasoconstriction. That's going to result in an increase in resistance in that vessel. So in response to this increase in pressure, we get vasoconstriction, which is going to increase the resistance to flow. So even though our pressure remains the same, now that we have this increased resistance, we are going to expect to see then a decrease in blood flow. So this is going to bring this back down closer to where we started. So this is demonstrating myogenic autoregulation, and it's most easy to see this in the face of an increase in pressure. We still maintain a relatively constant blood flow. Now, autoregulation will also explain what happens when we have a decrease in blood flow. But rather than viewing this from the myogenic standpoint, let's look at it from the standpoint of local metabolic factors. So again, we have our pressure, flow, and resistance. If our blood pressure drops and our resistance if our blood pressure drops and our resistance stays the same, we would expect blood flow to decrease. Resistance stays the same, pressure stays low, we would expect to see the blood flow to that tissue bed low as well. But realize if we have decreased blood flow, then we are going to have a buildup of these local metabolites. This buildup of local metabolites is then going to have an effect on the vascular smooth muscle, and it's going to cause vasodilation. And so if we vasodilate, we're going to be reducing the resistance. So we have a reduced pressure, but now we have a reduced resistance, so we should expect to see an increase in blood flow. So this is an example of autoregulation explained by using local factors to show how even in the face of a drop of blood pressure, we still are able to keep our blood flow relatively stable. Now there's other local factors that can play a role. I'm going to mention these just for completeness sake. Nitric oxide is very important. It does cause vasodilation, and that's important for a lot of normal health-related issues. This is one that we are all very familiar with, histamine. So this is part of an allergic response. So here's a picture of a child, actually my son when he was younger, when he had a rash. He had food allergies. And when he would eat food, that would cause certain foods that would cause the release of histamine, which would cause vasodilation of certain vessels to the skin, and that's what results in this red rash. These other factors are important. We're actually not going to talk about these in this class. So major control mechanisms determining the arteriolar size or the resistance of the arteriole. We have our extrinsic control, which we've said is primarily neural and hormonal, and this is primarily going to play a role in helping us maintain mean arterial pressure. The local factors, which is our autoregulation and our local buildup of metabolites, things that we talked about with active hyperemia, reactive hyperemia, or functional hyperemia. These are primarily going to be involved in adjusting blood flow to meet the metabolic needs of the tissue. So this is a good way to think about the importance of our extrinsic control of our nerves and hormones. Their primary function is to help us maintain mean arterial pressure. The local factors, their primary role is going to be involved in making sure that tissues get the blood flow they need to meet their metabolic demands.